So thank you so much for being here today with us at Your Town, and especially the Arts Are the Answer segment, where we're once again focusing on the arts and health, and this time we're really focusing in on the special needs of our youth. It's no surprise to any one of you that our youth are under considerable stress, and it's up to all of us to really find different pathways to make sure that they can cope and that they have great resources and that they know that we all really care and love them. So I'm really honored today to be with Todd Templeman as our first guest, and he is going to be talking us about a wonderful, amazing new program, or fairly new anyway, that's called AIM for Youth Mental Health. So Todd, thank you for being here.
Thanks for having me.
So Todd, you're fairly new to your position, right? Tell us how you found out about AIM and what is that all about?
AIM is a youth mental health nonprofit. It was founded by Susan Stillwell with a lot of help from her children, actually. Yeah, they Susan and her daughter were members of the National Charity League.
Oh, they're so great.
Yeah, and they were looking through the list of all of these nonprofits, and
Yeah.
they couldn't find one specifically national that was dedicated to youth mental health.
Oh, yeah.
And in fact, it was a great video that that her children put on. They went around LA and Monterey, and they asked people on the street, you know, for example, when you think of donating to helping children's cancer, who do you give to? And they instantly said, I'm drawing a blank all of a sudden. They instantly said St. Jude's.
They had a name.
Yeah, and they would have a name for several of these things, but when they asked them, what about youth mental health, everyone was drawing a blank.
Sure, yeah.
So Susan and her children founded AIM. And
do you remember when was that, like 4 years ago?
Yes, it was 2014, I believe.
Okay. This is what their logo looks like on this beautiful shirt. So Todd, tell us more about their motivation for establishing it. So they saw that there is nothing that they could see, particularly on the national scale, right? Right. So that's one thing that we can really cherish too, I have to say, is that here is an organization with a national perspective, but it was founded here and it's really rooted here, right?
Absolutely.
In Monterey County.
Well, one of the first things they did is they put on a fundraising dinner. And it was in Pebble Beach, and it turned out to raise, I believe, that first year they raised over $350,000, maybe
so
over
amazing,
400.
Instant success.
Yeah, and I think they put it on in a matter of weeks.
Yeah.
So they did the job of about 15 people, and I look at the photos of this, and when Susan and I were first speaking, and I was considering joining AIM,
yeah.
my eyes were getting wider and wider at the amount of things that they'd accomplished with a few people and not a ton of advanced planning, not a ton of strategy going into it.
Yeah.
And they were so successful that the actual, looking at the ratios of amount raised versus costs and just what they've accomplished in the first few years of AIM is staggering.
That's amazing. Yeah. So one of the things that I know about what AIM is doing is much like analogous to one of the groups that is doing something about cancer or whatnot. The AIM is funding researchers and things like that. Can you talk a little bit more about that full context, and then we'll talk about the ad contest that really involve the arts, particularly in making those connections?
I'd love to. Essentially what AIM is doing, part of it being a national movement, is funding postdoctoral research fellows. And the problem is that in the United States, you have to have a PhD in order to treat patients, for example. And one of the things that creates is a dearth of physicians who can actually provide clinical therapy to people,
so there's
to children.
A gap, a big old gap. Yeah.
And in fact, one of our scientific advisory board members who recently joined is from Oxford. And in England, he was responsible, along with an economist who was a member of parliament. They created a new national movement in the UK that would allow people to train to give therapy to others without actually having to be PhD level. You could have a master's degree and still help people.
Yeah, yeah.
And do no harm and yet still connect with them. And once they were properly diagnosed, instead of spending 10 minutes and coming up with a pharmacological solution, they would then put them in programs where they could do some of their therapy online. They could either connect with a therapist over Skype, or they could follow certain types of challenges could be helped through systems that were pre-programmed into a computer.
So the goal to make that kind of support more accessible?
Essentially to find clinical solutions, not necessarily pharmacological ones, to figure out the best way to get them to youth who need them, and then to scale properly, to scale nationally. And that's essentially AIM's mission, is to fund the research, to give careers to these postdoctoral researchers who are looking for funding and frankly spending too much time looking for funding.
Yeah.
And get them to work, get them to, and for example, one of our fellows, she is in her third year, she's almost finished with her AIM grant. They funded her with $250,000. And for 3 years, she's been working with preschoolers who have so much anxiety they haven't been able to go to school.
Wow, that's amazing.
Yeah, and so 3 years later, they're all in school. Every one of her, every one of the participants in her study, and she's got her results. She's getting ready to publish them.
That's phenomenal.
And we're going to figure out how to get that spread to other places.
So that's right. So in addition to funding the research, you're also, AIM is all about promoting public awareness of what the issues are, what the potential solutions are, the great need for more, really, right? So
yeah, more awareness, and in a positive way.
Yeah.
There is a lot of people say we need to reduce the stigma, but that plants in people's minds the word stigma, and there doesn't need to be that. I mean, we're taking to, instead of calling mental health challenges, instead of calling them disorders, we're calling them differences, and if you think about it, one of the things I don't have the board with me, but one of the things that absolutely gave me goosebumps the first day I started working for AIM was this background wallpaper. You may have seen it at the ad contest.
I did, yeah.
And it shows up all these beautiful letters. It says brave, curious, but in these other letters it says bipolar, it says anxious, and it has all of the different challenges that people face. And what I thought I was looking at was the child of a young person. The mind of a child of a young person, and it, I mean, if you think about it, even if you don't have a diagnosed disorder, if you remember being, 7 to 10 to 12, these words described your day. I feel brave, and 10 minutes later I feel absolutely terrified. And so I thought I was looking at this mind represented in words, and it just meant so much to me. It's
well, there's so much that AIM is really helping people understand, just the general public understand about what people are facing and how we might move forward. So one of the things that the way I encountered all of you is through your ad contest. Can you talk a little bit about the ad contest and how AIM is promoting public awareness through that?
Absolutely.
And engaging. The other thing that I love so much about it is it's actually not just promoting it in a passive way, but really engaging the youth in thinking about it and talking about it, and also making great artwork.
Well, absolutely. You were there. I mean, everyone in the room was swept away by the work of these young people in Monterey County.
And so this is the exhibition that you had, and my Rotary group, I am pleased to say, was helping with the reception for that and helping to make that exhibition happen.
So AIM went out, and this was before I arrived, but AIM went out into the schools and gave a very specific set of instructions for students, and they even went into I'm blanking on the name, the youth facility for
and the probation department youth
the
center.
Probation department, yes,
where we also have a big art program.
Right, and so it wasn't just schools; it was also these children that really needed to have a chance to connect with the rest of the world in their own way. And the instructions were very specific, talking about this message of mental health and the challenge that 1 in 5 children across America and across the world are facing mental health challenges, and then they set them loose. And for this one, it won second prize in its division. You just see the words "Stay alive, stay alive, stay alive. It's worth it," and it's such a powerful single image. And one of the things we emphasized with all of the participants was anyone can create an ad. if they think of it just as an art contest, they might think they have to have this natural-born skill to create beautiful images. And certainly some of the winners, you can see that they are artistically amazing. But some of the others that the judges were, their breath was taken away by people who were creating a message that was, you know, it was visually powerful, but it wasn't necessarily a masterpiece artistically. And I think every year we do this, anyone is going to have a chance to win. I mean, some of the people that came in very, very close to honorable mention categories, the judges were wishing that we could give out many more. You were participating. We were wishing we could somehow give an award to every one of them, not just to be nice, but because they were so breathtaking across the board.
That was one of the things that really struck me and the others participating with the Carmel Sunset Rotary Group. Was the care that the youth were taking. And I think that's a big part of what I really, really admire about your program. It's so far-reaching, and that particular ad contest, it's not just a competition. It just seemed like the youth were very engaged with the ideas, and that they really, just like this particular one, we're really trying to, I felt like they were trying to send a message to others who are struggling. Say, you know what, we can do this, you can do this, and it is really challenging. We understand. I felt like each piece in its own way, each one was totally different from the other. They were very unique expressions, but in a way calling out to others who are struggling. Say together we can do this.
Right.
And like this one you're saying, stay alive, it's worth it. People who are struggling the most at any particular time, that's the message we really want to make sure that gets through.
Absolutely. And I mean, I can say that just in Ames' office, everyone is treasuring the stack of entries. There's no way we're going to get rid of any of them. So we're like, what can we do with these?
What to do?
I think one of the things I want to suggest is I think we could even create a more global ad or animation using the past entries, because whether they won or not, I mean, our work every day is to get this word out and to try to figure out ways to raise awareness. And they're giving us these tips. I mean, they're giving us this inspiration. So every single day we can go flip through these things that, I mean, they're from middle school to high school. In fact, this year's second prize winner was a middle schooler, I think. And they're absolutely inspirational. The clarity of vision and expression is right there. And one of the things we want to do in the future is expand it to other cities and other regions, and make it so that if you participate and win an award in the ad contest, it's something you want to put on your transcript for college.
So I have ideas for you, connecting through Rotaries and arts councils, and the NEA does a poetry out loud contest, the National Endowment for the Arts, that starts in the school. And there's a competition there, and then goes to the state level of each state. Competition there. The winners of that go to DC. Competition there, and at that point they can win $20,000 in scholarship.
Great.
So there's a huge incentive to participate, but in that case, everyone who participates is the process that they go through is so profound that the prize is no longer really the incentive.
Right.
But it is a way, it's a structure that takes it from the high school. So instead of you had 6, 7, 8 high schools participating, middle schools,
right?
And so it's a chance. There's a potential to actually have everyone, middle school and high school age, participating, and you can just grow it that way. So I'll talk to you about that later.
I'd love to talk about that.
But one of the things that is really important for us. So this poster was made from artwork from last year's. Prior year's winner.
That was the first year, yes.
So, so these things are so important. As I understand, one of the things that they're expected to do is to incorporate things like a fact. There's 5.
There were 5
facts.
That in fact, I think on the back there's a little form that they filled out with the list of facts that they have to use at least one.
Yes, and I think that is also really such a great prompt. I think in a lot of our work we really find that in some ways the prompt is the answer. You know, if we give people the right launching pad, then they'll take it from there and do amazing things.
It's interesting you say that, because my first impression when I walked through, it was my second day on the job,
Yeah.
and I'm walking through helping people judge,
Yeah.
and I was thinking how focused that they had managed to get on this theme, and I hadn't even read the form yet. But
And that was it. I mean, you gave them just enough. That's also the important thing about these prompts, that it's not be overwhelming, because you can say so much and then the eyes glaze and you just can't focus. But
Right.
but you gave them choices. So, but one thing for us all to realize is that over 25% of young people are struggling in some way with their mental health, and that I love how you talk about it's time to end the silence and getting to solutions together. So
Right.
that is certainly a lot. So what do the students put so much of their heart into all of this? Here's another great
Looks so
example.
comic book. Yeah, that looks like a great comic book to me.
Yeah, it's just there's so much here. And here they have the fact over 17 million children suffering. And then they think about that. They think about what it feels like and where to take it. So,
well, you can see these creatures: bipolar, anxiety, fear. And what I love about this is they really are not inhibited. They're children that this art, in some ways, it might be disturbing for someone to see, but for me, it says this is how you can reach out to another certain group of children who would gravitate toward this art. And really connect with the person who made it.
Yeah.
And
feel heard, feel understood. So so tell us more about where you go from here. What else? You'll be continuing with this idea.
Absolutely, continuing
and you said
and
you're going
expanding.
to expand. It's expanding in terms of other cities
Yes.
and whatnot. So that's a very exciting thing to look forward to. Do you think you will do even more, maybe with social media or something like that? Is that in your future?
Well, I haven't even had a chance to talk with our founder, Susan, about it yet. But I think
so she's hearing about it first.
Yes, exactly right. I think some of this work is oriented toward children and youth, but AIM is also for young adults. And I think that as you get to an older level, there might be some animators out there who could take some of the images from. I mean, these are all original.
Yeah.
They give them to AIM, and we have the responsibility to do something wonderful with them.
Yeah.
And I'm wondering if one of those things might be taking them to make a national ad that could be animated, could use some of the characters, the unique creatures that they're creating. I mean, again, there were over 100 other pieces that I could have brought in today that every one of them has a unique, original way of presenting this concept where things are flowing out of children's minds. And you saw all of them. It's just a treasure trove of original material that I think could be used in amazing ways. And the other thing that blew me away is I kept thinking about it as a purely art contest in the first day I was with AIM. And I was reminded that ads are in any field you can imagine going into. Some of the teachers from a psychology class and teachers from an economics class had their students involved in the ad contest this year. And so although we definitely talk to all of the art teachers we can get a hold of, it's not limited just to art. It's if someone is artistic, but they also love delivering a message, I think this is the kind of contest that can really help them get a leg up on their college transcripts, on any field that they want to go into in the future.
Well, and in terms of communication, creativity is really an important component. In terms of empathy and how do you connect with others, creativity is an important component of all that too.
Right.
So it's not a big surprise to me that there would be people who think of themselves already, even at a young age, in different fields from the arts, who nevertheless have that perspective and that approach to life and approach to understanding things, and certainly in terms of approach to sharing that with others.
And you mentioned empathy. I mean, I think it comes off the page of every one of these.
I completely agree,
And that's where, I mean, advertising can, I mean, I think the greatest advertising is an empathetic process. I mean, that's kind of what you're saying.
That's right. That's what it's supposed to be, connecting.
It's kind of in its pure form.
Yeah.
Yeah.
So how about for you, in terms of your position at AIM, what are you hoping to accomplish, let's say, in the next couple years?
Essentially, doing more planning ahead for all of these events, because as I just could not believe the small amount of people who had their hands involved in pulling off these amazing things.
Well, they have good partners though, here and there and everywhere, right? So.
Right, on the board, and other volunteers in the Rotary clubs that are helping out. But it's, to me, it's grown so well and so strong so far. But it's time to, if it's going to go national like we intend to do, it's time to make these events even bigger and better and plan 9 months, a year out, and make sure that they're absolutely coordinated. So, and I mean, for example, we received all of these awards, and we're madly scanning them in and preserving them and figuring out what to do with them. But that alone, I think, can be part of an organized process that the kids will have a lot more fun with the way we're able to present the awards next year. And
that is wonderful.
Yeah.
So tell me more about an AIMS. Let's say in the next few years. Where do you see it? So you're thinking about nationally. Have you settled in on a model like franchising or something?
A couple of different models. One is really bare bones numbers. We're going to target raising $3 million this year as opposed to under $850,000, which we've done in the past. And part of that is the annual gala that takes place in Pebble Beach during Car Week every year. We have this amazing venue that Pebble Beach gives us that is right in the heart of Car Week. And it's
excellent.
Yeah, it's essentially AIM's economic engine. And to have that opportunity sort of gives us a responsibility to really do everything we can with it. And the scientific, I haven't even mentioned the scientific symposium. We have...
Oh no, I didn't know about that one.
Yeah, we have the most amazing scientific advisory board. If you look on our website, the list of who's who in child and youth mental health is second to none.
Wow.
And now they're global. We have, we just, Dr. McGorry, I think I'm pronouncing his name right, just joined us. He's from Melbourne. And he, similar to the way our new advisory board member from England implemented that national system I was telling you about, they've done the same thing in Australia. And they're coming from all over the world to visit us here in Pebble Beach again. It's May 15 through 17, 3 days. These are the finest minds in youth mental health, and they get to join us in Pebble Beach and just talk about solutions.
So can you tell me about that format? Is it open to the public? Is there any part open to the public? And how is that going to happen?
For this one, what we want is to give them as much time. I mean, these conversations can last 12 hours. And we want some people to be a fly on the wall and be able to listen to what they're talking about, but we want them to feel absolutely intellectually and creatively free.
Wow.
So it's going to be a very small, intimate group. There are going to be some guests there who are there so they can help us figure out how to scale and how to get the word out.
Oh, great.
But that's kind of a closed door thing. And we do plan to do that annually, and the format may change as we go. But
will you publish anything?
Oh, yeah.
Yeah, from that, yeah.
Absolutely.
Yeah.
We'll distill it into something we can communicate about.
Great.
And then when it comes to going more national, I think it's nice. It's so nice to have that fundraising component built in. I mean, it's a blessing.
That's the hardest thing for most groups, really.
Absolutely. And to have the scientific board that we can go to for advice to figure out what research to fund, where that's already national. I mean, that's happening at Stanford, USC, University of Michigan, Harvard, Yale. You can go on our website, see how much money we're funding to these specific fellows who are launching their careers because of AIM.
Wonderful. The arts and healing as a discipline, I think that's also really emerging as a really big force.
We're looking for research fellows, AIM research fellows, that will do studies that can help children right now.
Yeah.
And that was one of the original founding principles, was there are a lot of studies going on in the genome.
Yes,
there are a lot of people studying. Yeah, they want to find out how they can sort of prevent that first episode. And that's great, that's wonderful, but there aren't any other national nonprofits saying we want to get research and disseminate it to children that are going to be helped as soon as we can get to them.
Yeah.
And so that whether it's art, whether it's therapy, whether it's any combination of these things, we're interested. In fact, nowhere close to an expert. I'm reading so many of the books that are written by our advisory board.
Good, oh great.
So I have all this material, but one of the interviews, and I can't even remember, it wasn't a member of our board, but it was a clinical psychologist who'd been practicing for 30 years.
Yeah.
And they said, well, what's your biggest regret in life? And he said that I didn't pick up the piano.
Oh, see?
And they said, that's your biggest regret? And he goes, I know after 30 years of working with people how much it helps them, how much art helps them.
There we are.
Yeah.
There we are. So this is what our finding has been. We really the Arts Council came to all that really through a very circuitous route in which we had a teaching artist who was working with kids who are in the migrant education program. And she was noticing their tension and aggression. And she was asking around to social worker friends that she had, said, hey, what am I seeing? I don't understand what these are 8th graders and they are just like this all the time. What is happening? We're just in an art class after school.
Right.
Why are we seeing these kinds of behaviors? So the social workers were explaining these kids are under so much stress, and there's just varying and sundry reasons why it became like that. So Linda then started following along. There's a whole Salinas youth violence initiative to try to reduce the stress in Salinas among the youth. And then she ended up working with the Probation Department Youth Center. So we're going to be featuring her later on in the program and what she's talking about. And so that's how we came to it. She had a very strong background in expressive arts therapy, and then through our teaching, she was with these youth, and she realized that, wow, I helped myself through this. She was a breast cancer survivor, and that's how she really recovered. Was through her art process, and then she helped others do the same thing. Then she looked at the youth and said, I think I can do that here. And she has.
That's great.
So that's when we all, Linda and myself and a lot of other people, have been looking into the arts as healing ever since. And now, this is flash forward 7-8 years, and or more, actually. And now I'm seeing it pop up everywhere. So now when I'm looking for training modules, I find it at UCLA.
Great.
And so I think that's definitely the right track. That's all I can say for sure.
Well, it's something we're definitely going to look into as well. I mean, we have this board that advises us, and then they just go out and they find these postdocs who are ready to go do something helpful now, and they spend 30% of their time looking for money.
Yeah.
They're not supposed to be fundraisers. I mean, that's, let us maybe do that for you.
Yeah.
If we're really good at
That's
it,
wonderful.
maybe we can help take that 30% and reduce it to 10%, still do the vetting so that we know it's absolutely done properly, and make sure that it's as effective as we can spend every single dollar that comes in, but save them that anguish of going out and I just spent the first 28 years of my life studying to do something wonderful, and now I have to learn how to go do some other profession that I never intended to go into just to raise money so I can do what I
Right, and
trained
because
for.
they're not a nonprofit, they don't have the same capacity to like hire somebody to do that for them or anything like that, right? They just have to start doing things.
Well, I think they're affiliated with universities, but there are so many hoops and hurdles, and one of the founding desires of AIM was to take some of those away from them.
Yeah.
And that's what every member of our scientific advisory board, I mean, these are people who are at Yale, Harvard, University of Melbourne, and they have seen what these postdocs who've learned from them go through. So they're working directly with us. And it's not just, I mean, right now we have 3 researchers, and they are students of our advisory board, but we're very specific. It's not just associated with advisory board members. We're looking for someone at any university or anyone who has a great idea. And one of the things we want to do, like you mentioned the art program at UCLA, we can actively go look into that instead of waiting for them to apply to us.
Oh yeah, that's wonderful. That's really a big thing. Well, thank you so much for your
Thank you
wonderful
so much,
leadership.
Paulette.
Before I have to let you go, is there anything else you want people to know about AIM?
400 things? No, I think we covered everything. I know there were a few things I wanted to emphasize, but they can come to our website and contact us and just stay tuned. We've got a big year coming.
Thank you. Thank you so much for being here.
Thank you very much.
Thank you.